Welcome back, everybody. For some people, a little pill can be key when it comes to preventing a heart attack or stroke.
And that little pill is a blood thinner. And Dr. Satish Goel with First Coast Cardio is here to explain how blood thinners work and some of the new options that are available to patients. So welcome, Dr. Goel. It's great to have you here.
Thank you.
Just want to start. Let's demystify the blood thinner. What's it all about?
Well, thank you, Nikos, and thank you, Charlene, for having me on this show. It's a pleasure. So today, I'd like to talk about blood thinners. It's a very commonly misunderstood term. When you literally think about blood thinners, it would mean that the blood has a certain thickness, and you give a blood thinner and it becomes thinner. That's actually not what happens. A blood thinner is something that prevents the blood from clotting as fast as it otherwise would. So if you had a normal tendency for a person is if they start bleeding, the bleeding eventually stops, and that stops because the blood clots, and therefore you get a little coagulation formation. But when you give a blood thinner, the blood doesn't stop bleeding as fast as it otherwise would.
And so what are the different kinds of blood thinners then? Now that we understand what it does and why it does it, what are the different, how many options do you have?
So, you have a variety of options. There's a whole list of blood thinners that we can use. And different ones are indicated for different conditions. You can have something as simple as an aspirin, or something that's given intravenously only, doesn't come as a pill, and then in between a whole potpourri of blood thinners. So your doctor has to determine what's right for you. And so there could be an aspirin, there could be something that people call rat poison, Coumadin, and then there are some newer blood thinners, and then there are intravenous blood thinners. So there's a variety of stuff that you have that you can use, but your physician is best in a best position to decide that.
So when would someone need to be on a blood thinner? When should they ask their physician about that?
Yeah, so that's a very good question, Nikos, because in different situations you need to prevent the blood from clotting inside your body. So when you're clotting, when you're bleeding, that's a good thing, but when you clot inside your body, when you don't need to clot, that's not a good thing. So there are different situations where you want to prevent this quick clotting of the blood, because a blood clot can then obstruct the flow of blood in that blood vessel. So you want to prevent that. And there are several situations where you would want to give a blood thinner. Someone who has a tendency to have a heart attack. Heart attacks usually happen because you develop a blood clot inside the coronary arteries. So a blood thinner will reduce your chances. Same thing, you could develop a blood clot in the brain or give you a stroke. And then there are conditions of irregular heartbeat where you have a tendency to develop a blood clot called atrial fibrillation. So there are a variety of conditions where you would want to give a blood thinner.
Now on the blood thinner, you mentioned your blood doesn't tend to clot, so I would think that there are some risks associated with a blood thinner.
Yeah, so it's a double-edged sword. It is something you got to be very cautious about. There's just the right amount, and even then you're taking some risk. In general, the benefit you get from the drug is more than the risk associated with it, and that's why we still use it. So there's this risk of bleeding. That's the main problem. And the bleeding, if you bleed from the skin, that's still okay. And you may have seen a lot of people are black and blue all over the place because they spontaneously bleed on the skin. That's a cosmetic thing. It's important, but the more important things are, bleeding in your gut. So if you bleed in your stomach, people can bleed to death. And then bleeding in the brain can give you a stroke. So it's not to be taken lightly. Everybody should be monitored closely when they're on blood thinners to make sure they're not bleeding at places they're not supposed to bleed.
Sure.
So these are medicines that do a lot of good, but can hurt you too. So you need to be in close follow-up with your physician when you're on these medications.
So with all those risks in mind, I know there are some newer blood thinners that are out beyond the ones that you mentioned to us at the top here. Do any of them help with those risks, or are the newer ones better?
So, you know, the age-old standard blood thinner for many of these conditions is called Coumadin or warfarin. Warfarin is the generic name, and the common name is Coumadin. And the problem with that drug was you couldn't eat your greens. Now, you know, when we see people in the office, we want them to eat green vegetables, the healthy diet. And so, you know, it was difficult for patients to be on this medicine. And they had to have their blood tested, you know, once a week or once a month. I mean, it's hard to go to the doctor's office and get your blood tested once a week or once a month. So as a result, there was the need to develop some new medicines. And there was a lot of research, you know, and now we have 3 new medicines that can replace Coumadin. And those drugs can be taken as a pill every day. You know, you have to be an appropriate patient for that. Your physician has to determine that this is right for you. But if it's right for you, you don't need blood tests. And you can eat your greens. You can eat your salad. So a lot of the patients are loving it. Some people who didn't want to go on a blood thinner because of all these restrictions are now going on blood thinners. The risk of bleeding still continues, you know, and it's about 1% a year. But the benefits are there, and all these nuisance problems
So
are
can you
gone.
give us the names of the 3?
So there are 3 drugs. One is called apixaban. There's a drug called dabigatran, and there's a drug called Xarelto. Those drugs have been very useful and are being commonly prescribed now.
That's great. Well, that's good to know, particularly for folks who may be on a traditional medication and are very eager to find out what some of their options are. Thank you so much, Dr. Goel, for being here, and for First Coast Cardiovascular Institute for sponsoring this segment. Remember to know your body, know your risk factors, and work with your doctors to address them.
Yeah, and if you want more information about heart disease from First Coast Cardiovascular Institute, visit firstcoastcardio.com or just call 904-493-3333. Easy to remember.